Hi, this is Mary, and I wanted to make this recording and reach out regarding some information over this weekend that I've heard, and I wanted to break it down a little bit. First of all, through the years, we've heard over and over again two words: opioid crisis. And the national news has done a pretty good job of pounding that into their news stories every day. And when you actually take a news story and they can create a headline and then use numbers to manipulate to their agenda so that they can create something that is believable. But many people only stop to listen to the headline and then they move on. So what sticks in our minds is that headline, and then we move on about our day. But when you actually stop and you break that story down, the numbers just don't add up. And I had taken a piece and done that with that this last week. And so I wanted to remind everybody of that just because you hear something on the national news doesn't mean it's true or doesn't mean it's right. So the other thing that's going on is the CDC again is back to changing numbers and also trying to define pain. And I want to be very clear when I state this, that my pain is my pain only, and it is only defined by myself. And your pain is only your pain and is only defined by yourself. Same thing goes with the treatment for that pain. It should be only fit to myself and yourself. And the idea of a one-size-fits-all approach to a condition or an injury does not work. And this is the reason why it doesn't work. We all have different pain tolerances. We all metabolize meds differently. We all are different sizes. We all have different co-conditions or different problems, and our bodies are all unique in different ways. A lot of us also respond to meds differently. We sometimes have allergic reactions or just side effects from that meds that doesn't work as well. So when we are talking about pain control and pain control rights, we need to have that ability to be able to work with our doctor regarding that. And this is why I am asking for a total restoration of pain patients' rights to opioids. And that means chronic pain, acute pain, pain post-surgery, all pain. And the reason why is because the CDC has been stating that we have an opioid crisis. But in this country, more people die every year from alcohol. Also, more people die every year from tobacco. But you don't hear on the news them talking about the alcohol crisis or the tobacco crisis. And they're not instituting prohibition because we know how well that worked. And so when we meet with our doctors, we should be able to meet with them without the doctors having intrusion from the government, from their practice liability insurance, from their employers, from the patient insurance, and also from the pharmacies. Our doctors should be able to treat us individually to find out what is the best course of resolution for us without fearing any repercussions from any other source. There are more good doctors out there, and there are more good pain patients and patients in general than there are bad ones. And so we have a right in this country to consume alcohol, and we have a right in this country to use tobacco. And we need to have a right in this country, a total restoration of all of rights to pain patients. And there's only going to be one way to do this. So we have to work with our elected officials. And this means that proactively, very smart, very nice communication with elected officials is the key to solving this problem for many of us, because when the elected officials make changes, we are bound by those changes. So if we want to continue to have good doctors and be able to work with those doctors, and we want to have those doctors stick around and not retire and quit or push us off to other sources, we need to work really hard at being proactive. And I've heard some people say that they have written letters and they have not received a response. I've heard people say that they've sent in emails and they've not received a response. You're not always going to receive a response. It just doesn't happen. There is so much going on with these elected officials. And so we still need to do that though, because it does matter. And so reaching out in a positive way and telling your story, telling them that you have lost your rights to adequate pain treatment. You have lost your rights to be able to work because you've lost your rights to adequate pain treatment, or that you used to be able to do these functions and now that you can't because you've lost those rights. Or maybe you're fearful of losing those rights. Maybe you still have pain control options, but I wanted to reach out to you today because it is so important that we really do grasp hold of this, and that we also get other people that are pain patients and our loved ones involved in becoming proactive communicators to elected officials. So if you have any questions regarding how to do this, let me know. Also, you're contacting just your elected rep in your district, they may not care. So sometimes you have to reach a little further. And so eventually there are good elected officials out there that do care. And I know some of them, and they're wonderful people. And there are some of them out there that have chronic pain, or they have loved ones with chronic pain, and they've been waiting to hear from us and want to hear from us, and they want numbers so that they can actually say, look, I've heard from all these different patients, and this is what's going on right here in our district and right here in our country. So please remember, whenever you're looking at this whole situation, that you're taking into consideration that ideally we want to go back to having total rights, restore it all. The real killer is the illicit fentanyl, and that really needs to be what the government should be throwing money at if they're going to do anything. And that's their choice on how they treat that. But that really is not my problem, except for the fact it's affecting us. And so we need to make it very clear that there is a really distinct line as to what is a pain patient and how we need to be treated individually and with respect from our doctors, and not stigmatized like we have been. So if you have any questions, please leave them and let me know, and I'll try to help you. But we really need to get back on focus. Thanks.